So today we have Dr. Jenny Parsons with us, and I know it says Marchuk on the screen, but just recently got married, so you're now Dr. Jenny Parsons, correct?
Correct.
Awesome. And you are a naturopathic medical doctor with 148 certifications. Tell
Yeah.
me about that.
So I have actually 4 doctors underneath my belt from cellular physiology and licensed acupuncturist as well, and chiropractic, as well as naturopathic medicine and cellular nutrition.
Fantastic.
148 certifications kind of branch out through those doctors. So in physiology, it's going to be physical therapy, modalities, ultrasound therapies, chiropractic tools and modalities, stuff like that. When we're looking at acupuncture, there's a lot of certifications underneath that. I do 11 different types of acupuncture, acupressure, auriculotherapies, body clocking with nutrition and acupuncture. They go hand in hand. Neuroemotional techniquing, so getting the emotions out of the organs as well if they're negative, and increasing the positive emotions and the organs. And then naturopathic medicine just kind of binds everything together, where it takes the alphabet soup from my name and just kind of clumps it down into, I'm smart, but I'm really not that smart. No, I'm just kidding. But there's certification for everything. So if it's cupping, if it's needling, if it's dry needling, if it's using certain machines, got to be certified in everything I touch to actually, integrate into a patient's body.
Gotcha. All right.
Yeah.
Awesome. So we've been focusing on cancer. So, cancer has increased like 300% over the past few years in cases of cancer across the United States. So someone being diagnosed with cancer, what would they expect coming into your practice, whether it's virtual or in person?
So typically, and really honestly, cancer, no cancer, but really focusing on the cancer is an onboarding. So when I do an onboarding call, it's either going to be virtual or a patient that I'm wanting to come into my practice. That I will call them and I will send them a link to the patient portal. That portal is like a vault for them to see all of their subjectives that they told me, all of my objectives, the prognoses, diagnoses, any kind of therapies that they need, modalities that they need, any kind of prescriptions that need to go out their way. They're going to see everything from super bills, income that they have spent, percentages that I've taken off of their bills. I don't hide anything. So that is basically an onboarding basically into the vault. There, they can put their demographics in there, their labs in there, any kind of imaging, radiology, all of that. And so it's just basically a way for me to communicate with the patient in a personal health information setting where all of that is encrypted and none of it can be data breached or leaked.
Gotcha. So what would they expect from you as a naturopathic doctor versus like an oncologist?
Okay, so
focus?
Yeah, so oncology is going to tell them the diagnosis and what their suggestions are and recommendations are on what they need to do for the type of cancer that they have. And with naturopathic medicine, we work and we strive to get to the root of the problem, the whole body, and why did this happen? We can go all the way back to ancestry. And what I do specifically, and where I find that my practice is different, is I focus on cellular nutrition. I focus on cellular rejuvenation, optimal health with your cells. So if there is any toxicity within the cells, draining those out through lymphatic system, through massage therapy, through fascia blasting, tongue scraping, oral hygiene, sleep hygiene. We go through the entire hygiene regimen, which is nutrition. How you sleep at night, from the minute your eyes go to sleep, what happens through the night? Are we reaching our human growth hormone? Are we sleeping fully through the night? To when you open up your eyes in the morning, how does that look all day long? So I try to put patients on a body clocking so that their organ systems are working at optimal health. And if one organ is suffering just because of one emotion, we have to get that emotion out of there. We need to feed it 5 emotions on top of that one bad emotion.
Gotcha. Okay. So I've had a lot of cancer patients come on board and they've had their oncologist basically tell them that they didn't need to change their diet. They just need to do chemo or radiation. They didn't need to change their diet though. How do you feel about that?
Ill. I feel like I just ate some sugar. No, I'm just kidding. The number one thing that I recommend is, first and foremost, is sugar. If it's a complex carb, if it is fruit sugar, we have to starve those cancer cells and tumors and just the development of the mutation of the cells too, and work and strive very, very hard for those cells to stay dormanted, go away, not have to come back once someone is in remission.
Yeah.
So yeah, that's the approach that I take.
So one thing that was very unique when I was searching for naturopathic doctors, and I looked at quite a few, and we talked, you had a unique perspective because you actually focused on the patient and the patient's blood type for the
Yeah.
type of nutrition that they need, which was something unique that I found out there, right?
Absolutely. You know, when we talk about cellular nutrition, I got my doctorate at ULon University in Clearwater, Florida. And cellular nutrition, if you think about it, the cells are keeping you alive or they're killing you. It's one or the other. And if it's on the killing side, it's going to be either a slow fade or you're going to go in there to the oncologist after getting your testing and you're going to be told that you're in stage 3 or stage 4 by that time. You know, as a naturopathic medical doctor, I try to treat disease before disease even becomes the word cancer in the first place.
Yeah.
But when we're looking at the cells, we want to make sure that the cellular, even the membranes of the cell have a nice protected layer around them by eating very healthy, by having very good verbal responses from other people. The things that we talk about or the things that we watch or see or do are very healthy as well. It's all going to feed the cells. The cellular split is 90 to 120 days. So it takes a good 3 months of eliminating, pushing healthy foods back in, depending on your blood type, for a patient to actually start feeling better. Sometimes the patient will feel worse before they feel better because their cells are going through that change. But I just tell patients to hold on for a good 90 to 120 days and just watch that change happen gradually. It's not going to happen overnight. You know, the cancer didn't happen overnight either.
Yeah.
So yeah, that's how we have to work it.
Awesome. Now, can you tell me a little bit about your experience with patients with cancer, maybe some of your success stories?
Sure. So my biggest success story, I want to say, is closest to my heart, is my baby sister, Crystal. She had stage 4 breast cancer at 35 years old. And I really helped her throughout the way on detoxing metals through her body. She did undergo chemotherapy. And so we did a big metal detox with her, had her do acupuncture for just stress elimination, any organs that were showing up on her scans, making sure that she was getting acupuncture, acupressure, or massage adjustments and stuff like that, you know, to alleviate any kind of pain and stuff. She has survived the cancer and she is in remission. She's been in remission for a little over a year now.
Awesome.
Yeah.
So when we talk to people, obviously we have our 10,000 milligram RSO tincture, right? But I like to say that that tincture is part of a bigger protocol. You know, you have to get your nutrition right. You have to get your emotions right, all of that stuff.
Yeah.
So you have to have a whole, I don't know, whole body approach to
Right. And
releasing the
environmental
cancer, right?
Yeah, my sister's cancer, she got it from environmental, you know, and that's where we look at a whole two in when it comes to nutrition. And nutrition is not just food, that's going to be more dietary. I don't even qualify in the dietary selections when it comes to the boards. I'm a little overqualified. So they put me in the nutrition side of things where it looks at a whole of, you know, the whole body. That's environment, you know, the stresses, the good and bad stresses, like I said before, sleep, hygiene, food, all of it. The people that you surround yourself with, your spiritual faith, all of it. It's a whole. Yeah.
Awesome. Well, Dr. Parsons, I'm very excited to have you on the team and to be working with you, helping our cancer patients. And in general, you know, we've been working on the cancer nutrition guide for humans and really excited to get that out. You know, we're going to be launching that in January. So be on the lookout for that. And yeah, really excited to just help as many people as possible. So thank you so much.
Absolutely. I appreciate it. Thank you very much, Michael.